Inside your body, there's this incredible factory that works around the clock. It manages everything from cleaning your blood to storing energy. That's your liver. It's truly the body's silent hero. But what happens when that powerhouse starts to have problems? Let's take a look at the signals it sends when it's really crying for help. And this isn't just some hypothetical question. When the liver goes on strike, it's a big deal. It sends shockwaves through your entire system. So today, we're going to dive into exactly how that happens, from the very first signs of trouble to the cascade of complications that can follow. All right, so how does our hero get into trouble in the first place? Well, it's usually not just one thing. There are a whole bunch of different attackers, and each one has its own way of trying to take this vital organ down. We can basically boil it down to three main types of injury. First up, you've got accumulation. This is where the liver just gets overloaded with something it can't get rid of. Then there's inflammation, which is like a direct assault on its cells. And finally, you've got infection, where viruses basically hijack the whole operation. And you can see how different these paths can be. On one hand, you have a disease of accumulation, like hemochromatosis. The liver gets totally overwhelmed with iron, and that iron can then spill over into other organs. But on the other hand, you have a direct inflammatory attack, like alcoholic hepatitis. This can cause that deep yellowing of the skin called jaundice, and over time can lead to serious, irreversible scarring. And the list of threats goes on. Sometimes the body's own immune system can turn against the liver, like in primary biliary cirrhosis. Viruses like hepatitis B and C can set up shop for the long haul, causing chronic disease. And then there's hepatitis E. That one is especially dangerous for pregnant women. We're talking about a staggering 20% mortality rate. Just incredible. Okay, so we know the liver is sick, but how in the world do doctors figure out exactly what's causing it? Well, this is where the real medical detective work begins, using clues hidden right there in the blood to solve the mystery. Blood tests are the first tool out of the bag. If the serum ferritin level is through the roof, that just screams iron overload, hemochromatosis. The presence of these very specific anti-mitochondrial antibodies, that's a huge clue for PBC. And of course, a hepatitis serology panel is how we go on the hunt for those viral culprits. And speaking of viruses, let's take a closer look at the hepatitis B panel. Now, at first glance, it can look like a secret code, but it's really just a report card telling you the whole story of the infection. If you see HBsAg, that means there's an active infection right now. Anti-HBC means you've encountered the virus at some point, past or present. And HBsAb, that's the gold star. That means you're immune, either because you got the vaccine or because you recovered from an infection. Now, one of the most visible signs of a liver in deep trouble is something called ascites. That's a swollen abdomen that's filled up with fluid. To figure out if the liver is really the cause, doctors use this really clever calculation called the SAG. It's just a simple comparison of protein levels in the blood versus in that abdominal fluid. And here's the magic number you need to know, 1.1. If that SAG calculation is greater than 1.1, it's a really strong sign that the plumbing in the liver is all backed up. This condition is called portal hypertension, and that high pressure is literally forcing fluid out of the blood vessels and into the abdomen. And this brings us to the real heart of the issue, the domino effect. A failing liver doesn't just suffer by itself. No, it sets off a dangerous chain reaction, a cascade of complications that can affect your entire body. This path to a full-blown crisis often follows a predictable and really dangerous pattern. It all starts with scarring, which we call cirrhosis. That scar tissue creates the plumbing backup we were just talking about, portal hypertension. Then that high pressure causes fluid to leak, creating the ascites. And that big pool of stagnant fluid, it's the perfect breeding ground for a deadly infection called spontaneous bacterial peritonitis, or SBP. But the dominoes don't stop falling there. An infection like SBP can be the very thing that triggers the next, and maybe the most frightening complication of liver failure, a breakdown in how the brain functions. This is something called hepatic encephalopathy, and the best way to think about it is like this. Your liver is supposed to be filtering toxins out of your blood. When it fails, those toxins build up, they travel to your brain, and they create a kind of static on the brain's communication lines. This leads to confusion, serious sluggishness, and a really characteristic flapping tremor in the hands. And the cascade just keeps going. The kidneys can start to fail in a process we call hepatorenal syndrome. And ironically, it's often made worse by the very diuretics, or water pills, that are used to treat the fluid buildup.
And because the liver plays such a key role in managing blood sugar, its failure can lead to dangerously low levels or hypoglycemia. This is why checking blood glucose right away in any unconscious patient is so important.
So, with all these different crises unfolding at once, how do doctors actually step in and intervene? Well, this final part of our story is all about managing that aftermath and trying to stop those dominoes from falling. Now, because the failing liver can't make what it needs to clot blood, patients can start to bleed uncontrollably. It becomes a real race against time. For an active, life-threatening bleed, the immediate answer is fresh frozen plasma, or FFP. It's like a direct infusion of the missing clotting factors. Vitamin K is also given, but that's more of a longer-term solution. It helps the patient's own struggling liver try to make more of its own factors. Managing all these complications requires a whole toolkit of medications. To clear that brain fog from encephalopathy, there's lactulose. To prevent those high-pressure veins from bleeding, we use beta blockers. For that deadly SBP infection, the antibiotic cefotaxime is key. And for failing kidneys and bleeding, drugs like terlipressin can be absolute lifesavers. Let's zoom in on the game plan for encephalopathy because it's so important. The very first step is always to find and treat the trigger. Was it an infection? Was it constipation? Then you give lactulose, and here's a really crucial point. You maintain a normal protein diet. The old idea of restricting protein is actually not recommended anymore. Finally, an antibiotic called rifaximin can be used to help prevent it from coming back. And that brings us to our final thought for today. As we've seen, the failure of just one organ, the liver, can cause the brain, the kidneys, and the entire circulatory system to fall like dominoes. It's a pretty stark reminder of how deeply connected all the systems in our bodies are, and it leaves us with a big question. Does a problem in one system ever truly stay in one?